the point in time webinar that we're going to have. Just a note, I am going to keep everybody else that's in on their phones or has their speaker on mute. If you do have any questions throughout any of the presentation, feel free to just write the question in the type-in question box. I'm going to be looking at them throughout the presentation, and I'll just answer any questions that anybody has throughout the presentation. So you can write them in there, or you can always email after if you come up with anything after the presentation that I didn't answer during it. I'm going to go through both the survey, some logistics for the point in time count, and then also the process for HMIS programs, as well as entering paper surveys into SurveyMonkey. Alrighty. So just one thing I want to go over before we get started. Anything that I do talk about today, we do have references on our website, which is www.monarchhousing.org. We did create a point-in-time quick reference guide that basically gives, it's just a one-pager, double-sided, that kind of gives the information that you need when filling out the paper survey with anybody. There's also a point-in-time manual, as well as a data collection guide as far as entering information into SurveyMonkey. So there's a bunch of resources that we have on our website, so if you have any questions, you can also check that out. We will also be posting this webinar to our website after this afternoon. So if you have anybody who wasn't able to attend this afternoon but still wants to listen in on the webinar, they can go to our website most likely in the next couple days and check it out. So just to start off, I'm sure most of you know, but what is the point in time count? So the point in time count is something that happens every year. It's a count of the homeless persons in a given area on a single night. It counts both the sheltered and unsheltered population in a continuum. This year, it is a HUD required count for the unsheltered population as well. So that is something we want to stress to make sure that everybody is putting an emphasis on the unsheltered count as well as the sheltered count. So the point in time count should be statistically reliable, unduplicated, as I mentioned, inclusive of sheltered and unsheltered homeless, conducted during the last week of January, which this year it will be taking place on January 28th, and it will be asking about the night of January 27th. And it should be planned, coordinated, and carried out locally. Why do we do the point in time? It is a HUD requirement for continuum of care funding. But also, you know, it kind of gives us an opportunity to actually gather data for local planning purposes. It shows us who is the homeless. This is especially useful when trying to figure out the number of unsheltered. This is really the only way that we're able, besides PATH programs, to figure out how many unsheltered are really out there or are in need of services. Where the homeless are finding shelter, factors contributing to homelessness in the community, and what services are needed by the homeless in the community. So who to count in the PIC count? As I mentioned, we're counting both unsheltered and sheltered, as well as the at-risk of homelessness. So unsheltered is obviously anyone who is staying on the street, in a car, basically in a place that's just not meant for habitation. Shelter is anyone that was residing in an emergency shelter program, transitional housing program, or a hotel motel, you know, paid for through Board of Social Services or things like that. At risk of homelessness are those that are doubled up, about to be evicted, things like that. So we are still collecting information on those at-risk populations, but the only information that will be sent to HUD that they're looking for is the unsheltered and sheltered by HUD's definition. So how to count in 2015. Similar to last year, we're going to do the same process as far as how we're counting both the sheltered and unsheltered populations. So unsheltered, they will always have to have a paper survey done. The sheltered population, if it is a shelter program that is in HMIS, that means an emergency shelter or transitional housing project that is in HMIS, we will be able to pull the information directly from the system. I'm going to go into a little bit later the detail on what fields we'll really be looking at and how we're going to pull the information from there and confirm with the agencies that it is accurate. If it is a shelter program that is not in HMIS, we're expecting that that program will be able to do the paper surveys and then enter the information into SurveyMonkey. For the at-risk population, again, it's going to be the paper survey. One note, and I'm going to emphasize this probably a couple times, if there is a program in HMIS that is listed as a support service only program, meaning that they may provide hotel motel stays, they may provide back rent, or a number of things, but it's listed as an SSO program where they're capturing all the different types of services, we will not be able to pull your information from HMIS unless you have a separate program that is specifically labeled as an emergency shelter program for those hotel motel stays. We did send out a list to all the PIC coordinators the other day showing which SSO programs seem to have hotel motel placements. So, if you have any questions about that, you can reach out to your PIC coordinator for your county, or you can reach out to us here. In the past, we tried to run service reports and then run reports to, figure out which ones were in hotel motel and get the information from that, but it proves to be a difficult task. So unless the program is a separate program from the rest of the services provided in the SSO, we will not be able to pull that from HMIS. This is the shelter summary form. We did use this last year. I'm going to go into it in a little bit more detail a little later on. So now I'm going to go, or this is what the paper survey looks like. I'm going to go into a few specifics on how to do the count, and then I'm going to go into more details on the specific questions of the paper survey. So when is the 2015 point in time count? As I mentioned before, it will be held on January 28th, and similar to last year, we'll be asking where the person stayed the night before the count. So where were they staying on the night of January 27th? HUD did change a little bit of the time frame for this year, so there is the ability to do surveys for people up to 7 days after the count takes place. The idea of this is really try to capture a more accurate number of the unsheltered population. So anyone that was in a shelter on the night of the 27th, we should capture in some way, shape, or form through HMIS or paper surveys on the 28th or on the night of the 27th itself. For past programs in particular, or service-based agencies like food pantries or things like that, if you have a service provider that isn't going to be open or available to do surveys on the day of the 28th, this is kind of letting them have the ability to do surveys on anybody who comes into the food pantry or food kitchen and collect information on them, like I said, up to 7 days after the count takes place. The thing to keep in mind if you are going to use this extended time frame is you're always going to be asking about the night of January 27th. So even if someone comes in on that, Friday after the count, you're still going to be finding out where they stayed on the night of the 27th. If they say unsheltered, or if they were, doubled up and we want to collect that information, then that's a survey that you can fill out in the paper survey format and enter that information into SurveyMonkey. Just some general survey guidelines. Only one survey should be conducted per household. If you didn't do any surveys last year, but you did them in the past, this is a little bit different. I know in the past it was one survey per adult. Now we've changed it so that it can just be one survey per household. This is really important when you're doing paper surveys with people to make sure to ask if they've done a paper survey already with anyone. It's really just to try to avoid duplication. Surveys should be conducted by interviewers and should not be given to respondents to fill out. There are certain questions, that have the ability to check all that apply, but there's also questions where it should just be, the question should be read to them, and then once they give their answer, work with them to basically make sure you're categorizing it in the best way possible. If no response is given to any question on the paper survey, please leave it blank. The only ones that we're asking you to guess on is for question 6 on the survey. It goes into the characteristics of the head of household. This is the only one that we're saying put a guess to their age, gender, race, and ethnicity, and that is only for the respondent. If someone is unsure of any of the characteristics of their other members in their household, you can leave those blank, but for deduplication issues, we're asking that you at least try to fill out the age, gender, race, and ethnicity of the person filling out the survey with you. If there's no response to question 1, you don't have to fill out the survey. There's no way for us to know whether they were homeless, at risk, sheltered, unsheltered, so we won't be able to use the survey in our analysis. One thing to keep in mind when filling out the survey, if you are a veteran program, this goes for veteran program, domestic violence, mental health specific program. If your program only serves a specific population, when you are filling out the surveys for question number 6, please make sure that you are checking off that subpopulation for all of your clients. We've seen a couple programs, especially last year with some of the DV programs, that they were not checking off that they were victims of domestic violence, even though they were in a victim of domestic violence specific program. So that's one thing we are strongly emphasizing this year, is to make sure you're labeling the clients depending on what type of program it is, especially if you know that it to be true. If your program is in HMIS, paper surveys from your program will not be counted unless you identify that they were staying in a different location other than your program the night before. So if you are participating in the Project Homeless Connect at any of your continuums, or if you have someone walk into your agency who said they were unsheltered the night before, and you're filling out the survey, you just want to make sure that you are listing them as unsheltered, because if we just have them come in, where it's from your agency, you have an HMIS program, and you're listing them as an emergency shelter, we will disregard them, because we will assume that we've already collected that information from HMIS. So you want to be very clear on the survey what location people stayed in. Similar to that, during deduplication, an agency-conducted paper survey will be used over a duplicate from another count location. Mainly this will come in from a street count or from a Project Homeless Connect. So if we get a survey from an agency, we're obviously going to take that over a survey done with someone from a Project Homeless Connect site. And always, HMIS records will be used over paper surveys, always. So that kind of puts a strong emphasis to make sure that your HMIS data is up to date. We did see a couple paper surveys come in last year from agencies that were in HMIS that did have different data, even though they were the same person that they were reporting on. We assumed that this was because the HMIS was not up to date, so we did try to address that with those programs, but it's really important to make sure, especially on this night, that all of your information in HMIS is up to date. HMIS participating programs that are entering multiple services into the same program in HMIS will not be able to have their information pulled from the system for the PIT. This is what I was mentioning before about the SSO programs that are providing forms of emergency shelter like hotel motel stays, that are grouping them all together with back rent and things like that. We won't be able to pull it like we were able to last year. It needs to be a separate program. Just some quick tips for conducting interviews. Obviously, introduce yourself. Ask if they've already taken the survey. Again, this is for deduplication. Let the respondent know that the answers are anonymous. Conduct the survey in a quiet, private manner. Try not to ask compound questions. Use survey questions to guide the interview. Ask questions to clarify if necessary, especially if they give you an answer that may not fit into a category as easily as some of the questions have it. Be friendly, respectful, and polite, and thank respondents for their time. Okay, so I'm going to go into some of the specifics of the survey questions now. If you have a copy of the survey in front of you, it's going to match the questions in order exactly. So at the top of each survey, there is a spot for the code, county, agency, and program. This is about who is actually filling out the survey with the respondent. We're hoping that the PIC coordinators, we have asked the PIC coordinators to fill out this top part for all of the programs and to send each program a copy. So hopefully before the point in time, you will receive a copy of each type of survey that you're going to be filling out. So if you're doing one for your agency, you should receive one with the code, county, agency, and program already filled in. So question number 1, where did you spend the night of Tuesday, January 27th? This is the same as last year. All of the options, I think we may have just added a few. We tried to be as comprehensive as possible. Obviously, if what their answer is doesn't fit into any of these categories, there is the other. You should only be checking one of these. On that quick reference guide that I was talking about before, we did provide, similar to what we have on this sheet, on this slide here, just a brief definition of what each category means. This is especially useful if you have people volunteering who aren't really in the homeless field or have never done a point-in-time count before. So if they have any questions about what each of these types of housing actually is, we do have a definition for each of them on the quick reference guide that they can refer to. In what town did you spend the night? For this one, oh, and I just actually let me make one note before I move on. The first 6 questions are required. When you go in to fill them out in SurveyMonkey, some sort of answer will be required. Obviously, if the person doesn't have one for you, you're not going to be able to answer it, but we are trying to, at least for the first 6, gather as much information as possible. This one in particular, if they're only able to give you the county, we can figure out the state. It's trying to gather as much as possible. One thing that is really important is the program name and agency name. If you have someone who says that they stayed in an emergency shelter the night before, say you're at a Project Homeless Connect site, it's really important to try to at least get an agency or program name out of them to try to figure out where they actually were. The reason for this is we are trying to cut down a little bit on the deduplication than the way that we did it last year. So like I said, if it's an agency that was already in HMIS, then we know that we don't need to worry about this survey if it says that it stayed in an HMIS participating program. I don't think a lot of people really used the program name or agency name last year, so we're really trying to emphasize the use of this year. How long have you been living in your current situation? This is asking the respondent about their most recent continuous living situation. So one thing to keep in mind with this question is if the person is currently in a shelter program, so say you're a DV program that needs to fill out these surveys for everyone in the shelter, this would be the length of stay that they've been in the shelter for. It's not asking about their homelessness beforehand or where they were before they entered the shelter. It's about how long they've been in the shelter. So as it says, for instance, if the respondent has been homeless on and off for 2 years, but he or she lost their housing most recently 2 weeks ago, check off 8 days to 1 month. So it's really about their most recent situation. If you have been homeless less than 1 year, has there been another time within the past 12 months when you were homeless? I think this is a pretty self-explanatory question. Obviously, if the respondent has been homeless for more than 1 year, or if they've not been homeless 2 separate times in the last 12 months, you would choose NA. In the SurveyMonkey, which I'm going to go over in a little bit, there will be an option for no response and things like that for each of these questions, but on the survey itself, we left it blank. So you want to make sure if it's not applicable, you choose not applicable instead of leaving it blank, which implies no response. Have you been homeless at least 4 separate times within the past year? Again, yes or no response. So question 6, this is possibly one of the most important questions that we have. It's all about the characteristics of the household. So this top part, last year we noticed a couple people would either skip the top part or it wouldn't match up with the bottom part. I'm going to go into that in the next slide. But the first part is really just asking how many adults and how many children were in the household. If there are 0 of either, you should make sure you write in 0 so that the person who's entering the information, or if it's you, know that it's actually 0 and not just a missing number. And you want to make sure that you include the respondent in the total household size. So there should always be at least a 1 in either adults or children, depending on the household that you're interviewing. The other thing that's really important to keep in mind, this question is only referring to the household members that were in the same location of the respondent on the point in time. So if you say have someone in your shelter who is a woman, but she has 2 children who she left, say, I don't know, at a family member's house for the night, but she came into the shelter, you would only be able to fill out the information for the person in the shelter that night, because they're technically the only one who would be considered homeless on the night of the count. So it's only whoever shared the sleeping arrangements on that night that you want to count in this. The next section, which like I said is all of the characteristics information about the people in the household, this should match each line. There should be a line for each person that you've listed here. So if there are 4 people listed here, you should be filling out this information for all 4 persons in the household. You want to fill it out as completely as possible for every household member. Obviously, if the person who is responding, doesn't know, you can ask them to take their best guess, but if they don't have a response, you can leave it blank. Again, like I said, the ones you want to try to get are really the age, gender, race, and ethnicity for the respondent, and the gender and age, at least for each household member. Those are really the key to help us in deduplicating surveys. These are the options as far as the relationship to head of household, and then we're asking for the first initial, middle initial, and first 2 letters of the last name. Just a note on this from last year's surveys, if you are a DV program who does not feel comfortable inputting initials of clients, please contact us ahead of time or contact your PIC coordinator. We found some issues where most of this information was not filled out, and we ended up having to delete surveys, and then when we were confirming the information, it came back as an issue, and we had to add them back in later on. We could try to figure out something to where even if we put in X's for all of them, we're aware ahead of time that that's how it's coming in, so we'll know not to delete them because we know they're not duplicates. They were in a DV shelter or something like that. All of these options for the relationship to head of household, for the race, ethnicity, any of those categories are all listed on the quick reference guide as well. So it would be useful to have that if you are filling out paper surveys. For age, it's just a numerical value. For gender, it's female to male. It's female, male, and then this year it's a little bit different. So last year it was just transgender. This year HUD is looking as to whether they are transgender female to male or transgender male to female. So that is something that if they identify themselves as a transgender, to specify a little bit further with them as to female to male or male to female. Race has also changed a little bit. Last year there was an option for multiracial. This year, HUD actually just wants to see the numbers over in each of the categories. So if they want to see each category that the person identifies with. So if they identify as Black African American, as well as white and Asian, then you should just make sure you list each of them. In SurveyMonkey, you'll have the ability to basically check all that apply. So that's something to keep in mind that's a little bit different this year. And same as last year, even if the person identifies themselves as Hispanic or Latino, it's important to also try to capture a race for them, asking them what race they identify with. We know it's a little bit difficult sometimes, but HUD is asking for both. And then, like I said, if the respondent gives no response for household members, try to at least get their gender and age for each. So these are the household characteristics that I was talking about before as far as a veteran program or domestic violence program. You should try to get each characteristic for each household, if any apply. There is the none apply at the end, so please make sure if they don't have a disability, you don't just leave it blank, you hit none apply, because if it comes back with nothing on it, it seems as though it's a no response as opposed to none apply. Again, the same with the locations. We have a brief definition of each type of household characteristic on that quick reference guide for anybody to refer to. One thing to keep in mind with this too is it's pretty subjective as far as if the client feels that they have a mental health issue. There's no real, it doesn't have to be a diagnosis. As far as the veteran question, it's a pretty broad definition. It's really just about asking them if any of them were a veteran, any have mental health issues, things like that, and letting them basically be the deciding factor as to whether they feel they should report that or not. So again, like I mentioned before, the number of people you list as in the household should match the number of rows you are filling out as far as each household member. We used this as a check last year, and we know that sometimes it didn't match up. So this could be, if anybody's filling out the survey, it could be used as a check to make sure that they've, provided information on all of the persons in the household. So the rest of the questions, while they're not required and they're not used to report to HUD, they are used for local planning purposes. So we are still asking that you try to collect as much information. It's just when you're entering them into SurveyMonkey, they're no longer the required fields. So where was your last permanent address before becoming homeless? Obviously, if they can give you as much as possible, that would be best case. What was your residence prior to your current living situation? So we changed the format of this question, but it's the same question as last year. You want to only check one, and really it'd be best to probably just ask the person the question, let them see how they respond, and then categorize it the way it should be. We do have definitions for this in the data collection guide, which I said is posted on our website in section 5, page 7, in case you have any questions about what these categories are. They're basically pretty similar to question 1, so you can also refer to those. We tried to separate them into categories just to make it a little bit easier. There were some questions regarding, friends and family and whether that was permanent or temporary, so we tried to combine it a little bit, make it a little easier. The next question is, which of the following do you or anyone in your household receive? The way we suggest doing this is really reading down the list and just asking them if they have any of these sources or any of these non-cash benefits. At the bottom, there is a no source of income or receiving no government benefits. Please, again, make sure that you check that off if they say they don't have any, as opposed to leaving it blank. Again, just like the other ones, we do have brief definitions available in case anyone has any questions on what these types of benefits or income sources are. And again, you should be checking all that apply. What is your total monthly household income? So this is a little bit different, again, not from the survey last year, but from the previous survey if you didn't do it last year. In the past, it had been annual income. We then changed it to just ask what the monthly household income is, since we know most people will know how much they get for SSI or GA or things like that, as opposed to their annual income overall. Again, earned income should include any income for household members 18 or older and any non-earned income for household members 17 or younger. So any disability payments they get or things like that for 17 or younger should be included as well. Would you or anyone in your household like to receive any of the following services? Again, it's a check all that apply, and you can really just read the list to them and see what they're interested in. And then what was the primary factor that contributed to or caused your current living situation? For this one, we are only looking for one answer. It really is about the primary cause of homelessness. Again, a lot of them will, may say we've seen a lot in the past eviction as the answer, and sometimes we know that there may be issue deeper than that, or there may have been a cause that was more than just a blanket eviction. So we really want to go with the primary factor. So that is the paper survey themselves. Obviously, after you complete the survey, you want to make sure that all answers are complete and legible. Obviously, it's a little bit easier if you're the person who's collecting the information that's also putting it into SurveyMonkey, but we know a lot of times some surveys might just be collected or it's given to a different person to do the actual data entry. So you just want to make sure that everything you check off on the survey is legible. And then after all of the data has been entered into SurveyMonkey, you want to turn in the paper surveys to your local PIC coordinators, just for them to hold on to in case we have any, while we're going through the surveys and the data, if we have any issues with any of it, we're able to then refer back to the paper surveys if need be. Okay, so I'm going to go into the SurveyMonkey. I'm going to go through this pretty quickly. It's really pretty straightforward. It matches the survey question by question, so I'm just going to kind of go through the basics. And then, like I said, if anybody has any questions, feel free to just type it in the question box as I'm going through it. So as far as the timeline, there is a practice online survey link that is available. Everybody should have received it at this point, so if you haven't, you can send us an email or email your PIC coordinator, but it is available in case you want to go on and just familiarize yourself with the software. There, anybody that is entered into the practice survey obviously will not count towards the point in time count, so anything that goes in there will just be thrown out once the live survey is sent out. The live survey link will be available starting Wednesday, January 21st, and it will close Wednesday, February 11th. Last year, we only gave 1 week after the point in time took place for people to enter it in, but with the extension of the 7-day window for additional unsheltered surveys and basically just because of the complaints we received last year as far as it not being enough time, we extended the deadline, so everybody has 2 weeks now to enter the information actually into SurveyMonkey. The reason why it is open a week before is really for boards of social services or long-term program stays that are not in HMIS. So if a person's on a TRA or in a hotel motel and they know that they'll be there on the night of the 27th, they're able to enter them in early. There should be no unsheltered surveys or any other surveys going in before the night of the 27th itself. The date of the count is obviously the 28th, asking about the 27th with that 7-day window. And all things must be entered into SurveyMonkey no later than February 11th by 5 p.m. Last year we did a couple of extensions for people who called. We're not doing extensions again. We're giving everybody 2 weeks, and we really need to make sure we have enough time to, deduplicate the information and then to start to really analyze the data to still get the reports out in a reasonable time frame. So that's why we're not going to extend it past the February 11th. So inputting data online, obviously you want to click the link that will be emailed to you for the live survey, and you want to make sure you're using the live survey. We try to recommend that it's one person from each agency that enters the survey data, but if that's not possible because there's a large amount of surveys, which we understand, really just make sure that everybody's kind of entering information in the same way. So one thing in particular that we saw last year is we saw surveys coming in from the same program, but one would categorize the program as a transitional housing program, and somebody else who was entering that in was categorizing it as a substance abuse treatment facility. So you really want to make sure that if there's more than one person entering information in, that everybody is aware of the classifications of things and that they're entering data in a uniform way. If a question requires an answer but the respondent did not respond or left a question blank, obviously select no response. If question 1, gender or age fields are missing, and gender and age only goes to the head of household, if those 3 fields are missing, you don't have to put the survey online. We need question 1 to identify if they're homeless or not, and we really need the gender and age to do the deduplication. So if we don't have those 3 fields on a survey, we're not going to be able to accept it. So those are the ones that you really want to focus on. Every question with an asterisk must be answered throughout the survey. So that's, again, like I said, the first 6. So the first page of the survey will need to be filled out in SurveyMonkey. The 7, it's not required to put in anything in order to move forward. There will be, the same as last year, there will be a next and a previous button at the bottom of each section of the survey online. So you just want to make sure when you hit that next button at the bottom of the page, if you are brought back to that same page, it's because you missed something and you didn't fill something out. It won't bring you back unless you missed something. So you just want to make sure that you're able to move forward and fill out each question completely. So this is the part I'm going to go through pretty quickly. So obviously, you have to enter in the code, county, agency, and program. Like I said, that will be at the top of your survey, hopefully already filled out. So anyone where it's check 1 only, it will look like this, and you'll only be able to check 1. There will always be an other box where you can type in, the answer that the person gave to you if it doesn't make sense or doesn't fit into any of these categories. In what town did you spend the night? So this is a required question. Now, if the person only gave you a town, you're only required to type in to fill out one of these in order to move forward. So if the person only gave you the state, then that's fine. You'll still be able to move forward in it. Like I said, you want to try to fill it out as completely as possible, but it's only one row is required in order to move forward. If the person did not give you an answer, you just want to write none in the town field and then save it, and it will let you move forward with the survey. How long have you been homeless? Obviously, it's the same. Choose one. Same for here. Like I was mentioning before, there is the option in SurveyMonkey, yes, no, NA, and no response. So just make sure if it's left blank on the paper survey itself, you're filling it out as a no response as opposed to NA. Okay, so one note I want to make, so this is question 6B. This is all about the characteristics, obviously. On the paper survey itself, we pre-populated the first row so that the relationship to head of household is identified as self. As far as who the head of household is, it's really whoever's filling out the survey with you. So it doesn't matter if there's, an older adult than the person who's sitting in front of you. The head of household is always going to be who's answering the survey for you. So you just want to make sure that when you're filling it out in SurveyMonkey, you're making sure that this first row is always used for that head of household. And obviously you can see here the lines, unfortunately because of the formatting differences, the lines don't match up exactly, so you just want to make sure that when you're filling out characteristics for the head of household, it's always in row 1, 2 matches 2, 3, 3, and so on. So this is, just a basic of how to go through. Obviously, answer the head of household, first initial. These are all drop-down menus, and they all have the ability to do a no response. So this is the way that the race is set up, which, like I said, is different than last year. There is a no response option, and it's really just a click all that apply. The same for the household characteristics. This is the same as last year. Check all that apply. Make sure that you're not, if they have a disability, not checking none apply or no response, and just make sure that there's none that are coming in that have a none apply and a no response. You just want to make sure it's only one for each household member. So these are the questions that obviously are not required. So if the respondent is not homeless for this one, you can just put NA in the town field. If no answer has been given, you can obviously leave it blank. Residence prior. So the only difference in this one is it doesn't have the category headings like on the paper survey, but otherwise it's the same order. Everything is the same. The only formatting thing to keep in mind with this question as far as the income and non-cash benefits is on the paper survey, they're both listed in columns, and then at the bottom of each it says no source of income and no government benefits. Because we had to add in this other, this no source of income ended up going to the top. So that's the only formatting thing that doesn't match the survey exactly. Total monthly household income, only enter a number value, don't enter commas, no periods. If no response is available, obviously you can just leave it blank. For this one, the services, it is a check all that apply. There is the other box that's available, and then the primary factor is obviously only choose one option. Again, the other is available. One thing we did add from last year, because of the large number of responses we got for it, so household breakup or death in household, we did add that as a category since a lot of paper surveys were coming in with that response anyway. So after finishing page 4 of the online survey, which obviously the last question would be this one, you see this done button at the bottom. As long as you're sure that you're done, you should hit the done button, and then it should bring you to a screen that looks like this. If you do not see this screen after you hit the done button, then there's something that is missing and you need to make sure that you update it and then submit it. If you don't see this, your survey was not submitted. So just something to keep in mind so that we don't miss out on any surveys. You need to make sure you see the final submission page before you move on to the next one. If you have more surveys that you need to submit afterwards, then you hit this done button again, and it'll bring you to a fresh page to start answering questions on again. Okay, just again, I'm going to try to go through this quickly. The sheltered HMIS count. Oh, so before we get into HMIS specifically, so the sheltered summary form is something we tried to implement last year. I think we got only a small number of the summary forms actually back from agencies, but for the programs that did provide it to us, it was actually very helpful. So really the purpose of this form is kind of for us to have a double check. This form is required for all emergency shelter and transitional housing programs, whether they're in HMIS or not. And the purpose of it is really to see how many people you're saying you served on the night of the 27th, so that when we pull our HMIS report or when we're looking at the surveys that we're getting in from your agency, we're able to double check the numbers and can come back to the agency and say, you know, there seems to be a discrepancy. You said you were going to serve 20, but there's only 15 in HMIS. Or you said you were going to serve 20 and there's 25 surveys that are coming in from your agency. So what's going on there? All it really is the county, agency name, program name, and the HMIS program name, obviously, if it's in the system, whether you serve individuals or families or both, total number of beds, and total number of people served on the night of the count. So that's really, you know, the most important one right there. The reason why we have more than one option is obviously if your agency has more than one program type, you just want to fill out one block for each program. So this is due to your PIC coordinators by January 29th at 5 p.m. Again, this is for all shelter and transitional housing programs. So we can, you know, have a sense of how many shelter numbers we should be expecting. So as far as HMIS and the point-in-time time frame, so obviously we will be looking at anybody who is in your HMIS program on the night of the 27th. So the thing to keep in mind is if somebody comes into your program on the night of the 28th and you're going to enter them into the program, but they were, say, unsheltered the night before, we won't be able to capture their information using HMIS. So if possible, we're asking that you fill out a paper survey for them. If they were in another shelter program the night before, then obviously you don't need to do a paper survey for them. It's really if they were unsheltered or double up. So we're looking at that time frame. We will do our first HMIS pull on Wednesday, February 4th at 1 p.m. Basically, we're just going to pull the information for each program and send it out to the agencies to confirm that the numbers are right or that the information looks right. You'll then have a week from there to verify your HMIS data. Update anything, you know, make sure that there's no birth dates that should be, you know, there's no birth dates that happen to be intake dates, so they're showing up as, you know, a 0-year-old in a emergency shelter program by themselves. Things like that is what we're asking you to kind of take a look at. So our final pull will be done February 11th by 5 p.m. So you just want to make sure everything is updated in the system by then. Like I said, you want to ensure accurate information is entered for all program participants. This means also if you have a program, say a transitional housing program, where you may have not discharged everyone and they are not going to be in the program on the 27th, you want to make sure that you do all of your discharges before we pull the information for the point in time. You also want to make sure that both the individual and household level information is accurate. So if you have a mother and her 2 children in your program, you should make sure that you're entering information on all 3 and not just the head of household. Otherwise, you know, that's 2 people that we won't be able to count in the point in time. You also want to make sure that you're updating any information that may have been missed at their initial intake that you actually have available. So if they have a certain disability that you found out about after they already entered the program and after you already entered them into HMIS, you want to make sure that you're going in and updating that information as well. So these are the important HMIS fields that we will be pulling for the PIT. There is a list of them on our website, so you can go on there and take a look to make sure that all of these fields are filled in for everybody on the point in time. Really the way we will be pulling this, and we should already have it in the system, but if not, we will be sending out the report name that we've created in HMIS, and really it's just going to be an HMIS report builder with each of these categories. So you'll be able to run that report, on your agency side to make sure that everything has an answer, and that there's no responses or don't knows for any of these questions, which would prevent us from, collecting some of the information or calculating some of the characteristics. So for chronically homeless, these are the different categories we're going to be using to calculate chronically homeless. These are the fields that we're going to be using to come up with the unique identifiers so that we can compare HMIS data and paper survey data. Again, with the date of birth, just make sure that you're not confusing admission date and date of birth. We've seen it a couple times, so that's definitely going to be one day where it's important to not make that error. And also you want to make sure the same that I was talking about with the disabilities, if a household income has changed, you want to make sure you have the most up-to-date income in there. Especially for transitional housing programs, if the people have been in there for a year already, you should be doing the updates. So you want to make sure that all of those updates are done by the 27th. Disabilities and then client status. If you're unsure about how to update or correct data, HMFA does have training resources on their website, which it is listed down here, so you can check that out. I know that each of you also has, a TA provider from HMFA, so if you have any questions, you should be able to reach out to them, run a report on your own to make sure that all of your data is accurate, especially, when we send you that initial data that when we do the poll on February 4th, you really want to make sure that if you have any issues or questions about updating that information, that's when you reach out to HMFA. So I do have a question. It says, so during the point in time, a motel program in HMIS under supportive services has to be counted on a paper survey and will not be extracted from HMIS. Yes. So unless that program has a separate program in HMIS, it can be a support service program, but it has to be solely for hotel-motel stays. So unless there is a program that's specifically for hotel-motel where we can just include it in the count, it will have to be done through paper surveys. And just a note on that in general, the information that is coming from HMIS isn't just useful for the point in time. There's also the annual homeless assessment report, and it would be really useful to be able to count hotel-motel stays and things like that in the AHAR. And the only way that we would be able to do that is if the hotel-motel stays are in a separate program from the rest of the services. And the reason why that's necessary is in order to find out who received a hotel-motel stay versus a back rent or versus, some other type of assistance, we would have to run a service report and then a report builder, an HMIS report builder to find the characteristics of that household. So there's no way for the AHAR to pull out just those that received hotel-motel stays. So it's really beneficial in more than one way if we're able to, work with your agency to get a separate program to just list the hotel-motel stays or those that are receiving some form of emergency shelter. Okay, so if you do have questions, obviously you can contact your local point-in-time coordinator. We are having another webinar that will take place, I think it's February 26th at 10 a.m. I know each continuum is having its own trainings, so if you have any questions on when additional trainings are, if you have other staff that have trainings, you can reach out to us or to your local PIC coordinators to find out when they are. So that is everything that I have. I guess if anybody has any other questions and want to type it into the question box, the question about the hotel motels was the only one that I've received thus far. If you are not sure if there's a Project Homeless Connect event going on in your continuum, make sure that you reach out to your point in time coordinator for the county. If you have a question on who your point in time coordinator is, firstly, it's most likely the person who sent you the email about the webinar. Otherwise, you can reach out to Monarch and we can let you know who the best person to contact to participate in the point in time is. All right, so if nobody else has any other questions, then I think that's all I have. So thank you for coming. And like I said, all of our items are also on our website. So if you have any additional questions, you can check there or reach out to us. All righty, have a great day.